Good afternoon once again, everyone out there, Facebook Live. My name is Robert Hall. I am the co-chair of Project Elect. Project Elect is the acronym for Enthusiastic Leaders Engaging in Changing Times. We formed a little bit over 2.5 years ago. We consist of, right now, 12 board members of various and diverse backgrounds. And so one of the things that we plan to do and try to do, one of our goals is to get information out to the public. There's nothing more detrimental than information, especially in these times. We do work under the leadership of our chairman, Reverend Jeffrey Daniel, serves as our chair. But tonight we have the continuing conversation of the coronavirus, COVID-19. Last Wednesday, we talked a little bit about the vaccine and what that consists of, but we promised that we would carry over tonight, continue that vaccine, but to also bring victims and coronavirus, COVID-19 survivors on stage. So tonight I have with me our newest member, and right now he's holding the record of the hardest working member of Project Elect, Dr. Vernon Rayford, internal medicine here in Tupelo. We're proud to have this young man. He's not only serving in his role as a doctor in internal medicine, but he's given his time away from his family, other things, to come here and work in the community extra. We also have with us tonight Kenneth Wheeler. Kenneth, we know he serves with the Tupelo School Board, but he also serves as the security director for the North Mississippi Medical Center. And Kenneth, we thank you for allowing us to be here in this awesome auditorium. And I won't mention the other 50 jobs that you have. Kenneth also serves as the secretary of Project Elect. Thirdly, we have none other than Pastor Bishop Willie Wilson, which is the longtime pastor of New Life in Tupelo, Mississippi, and he serves his community well, also with a radio show outside of Project Elect, and you've been a member from our inception. Right. So to not prolong the time, thank all of you that's joining us, and thank all of you that will join us, and keep in mind that you can upload questions later for Dr. Rayford and the others if you need to, even after we go off the air. So we're going to dive right in. Dr. Rayford, so the last time we talked about, the coronavirus, COVID-19, some of the causes. But tonight we have actual COVID-19 survivors, and Bishop Willie Wilson and Kenneth Wheeler. So we just want to start the conversation tonight of maybe asking, I'll start with Kenneth, and then once Kenneth answers the question, Dr. Rayford will kind of maybe just dive in and explain to us what's going on during the process of COVID-19. So first of all, Kenneth, when did you develop symptoms, and how long has it been since you actually started struggling with COVID-19?
Well, I recognized something was going on December 7th, Pearl Harbor Day. That's the way I remembered it. Okay. And it also, more so than that, it was 1 week before my daughter's wedding. And so, I was with some group of friends on that Saturday, and we played unusual number of rounds of golf. And I thought I was kind of fatigued from that. And so the next day, in preparation for the wedding coming up the following week, my son and I were doing some preparation in my daughter's backyard, which is where she had a wedding. And, we talk about recovery time. I'm used to working hard, and give me a couple hours and I recover and I can go back to working or whatever. But I noticed that I started coming out with some chills, body aches, strange sore throat kind of thing. And so that was on Sunday evening. By Monday morning, I was really hurting, and temperature was right at 100.8, I believe. Wow. So I said, well, let me go to my clinic, because I don't want to give anybody anything in my workplace, and I got 30-something people that work in my department. And so I went to the Barnes Crossing Clinic, and my health care provider said, not only do you need to lose some weight, but son, you got COVID. So you're a fat boy with COVID. That's not a good combination.
Wow. So you were fatigued, and But you
fatigue.
weren't feeling any pain at that point.
Well, first of all, fatigue, and then pain usually after I work hard, because I had a shovel, okay, and was digging a trench about 40-something foot long, about a foot and a half deep. And so my son and I, so if you ever use a shovel, that's some hard work. So, but I'm thinking my recovery should come along pretty quick, and it did not, and that's what threw me off. That's what had me concerned, and so so by Monday morning, with a temperature and chills and that kind of thing, and sweating, I said, no, this is something else. So I said,
okay.
rather, because I mean, for me, it would break my heart if I knew I contaminated somebody else from this thing. So I said, I need to go see about this thing right now.
Okay. So, Dr. Rayford, is that part of the beginning signs of COVID? And I don't know what day when he was feeling the chills or fatigue. Can you kind of expound on that for us?
Well, it can be. What I'll say is early on when we were first learning about coronavirus, we would say the most common symptoms of coronavirus would be fever, dry cough, shortness of breath, followed by headache, muscle aches, fatigue. What we've learned since coronavirus has been running rampant in the communities is that there can be a variety of symptoms, that symptoms do change, that if you monitor somebody long enough, you'll find some of the cardinal symptoms, so the fever, shortness of breath, and dry cough. So it's really important that if you feel different, it could be coronavirus. And I think with the numbers in our community that we need to let people know that if you feel different, it can be coronavirus. You should get evaluated at that point, because you can start isolating and minimize the spread. And so, waiting to develop more characteristic coronavirus symptoms, you may unwittingly expose more people to coronavirus. So simply put, if you don't feel the same, and there's not a great explanation, then it could be coronavirus. If you're feeling something like, cold symptoms and things like that, sore throat, it could be coronavirus. That's, summer cold, winter colds aren't necessarily happening. It's coronavirus. So it's really important to get tested. Also is worth noting that early on in the course of the infection, your test may not be positive. So if you have a high suspicion for coronavirus because someone that's really close to you tested positive, there's a chance that you will indeed have coronavirus. You just won't test positive until a few days later, until your symptoms progress.
So in other words, what you're saying is, and this is just in my mind, treat it as COVID-19 until it's proven not.
It's COVID until it's proven not, and a negative COVID test does not disprove COVID.
Wow.
So it's really important to recognize that. I think as our ability to get testing has improved, many people unfortunately use testing as the get out of COVID consideration card, and that's far from the truth. Again, if you're early in the course of the infection, then you may test negative. If you're using the fast coronavirus test, we know that those tests, at the expense of being fast, you jeopardize accuracy. So there's a lot of people with coronavirus who will test negative on the fast test. So again, you can't use the coronavirus, especially the fast test, and we call that the antigen test. You can't use the fast antigen test to disprove coronavirus. So now, if I have someone that I think has coronavirus, if they have a negative antigen test, I will send for the test that takes a little longer, the test we call the PCR test, because that test is better able to be positive in people who do have coronavirus.
Okay. Now I want to come back to that PCR and ask that question, but also, while we got Bishop Wilson here.
Robert, let me throw one
Sure.
quick. For me, as an individual, I'm not medically trained, but the key motivating factor for me was when my temperature went up. That's unusual. I'm sweating, and we got a little home thermometer thing, and that was accurate as enough for me. If you don't know what your body temperature is, it should be 98.7. Mm-hmm. Well, I was almost 101. And so you sweating, and you that's an indicator. You need to go see somebody. I mean, you know, you need, just go get tested. Go talk to your healthcare provider. If you don't have one, find one. That's the key thing. A lot of people don't have healthcare providers. You know, I'm not doing a shameless plug for Dr. Rayford. Now, I don't know what his patient list looks like, but I mean, call his nurse and she could tell you, he could tell you, you know, if he has room for another patient. But at least go get some information. Go
get it done.
Go. Don't sit there and just wait. But that bump may go away. That bump may get bigger. Okay.
Wow.
Bishop Wilson.
So Bishop, now I can remember in our conversation when you were dealing with it, I called you one time over the phone. Right. And I could not even understand what you were saying. And later you said hallucinations. And I know Kenneth has told us about his, you know, symptoms. So can you dive into that? And then we want to ask Dr. Rayford, you know, what he thinks about that.
Okay. Well, actually, what happened with me is just telling the whole story. I went to church one night, and they were talking about, you know, about to close the churches down, right? I'm like, no, we're not gonna close down. I'm like, so it went on. I think it was like on Friday night, and then maybe Sunday, when I went back to church, I had that dry cough, Doc, that you're talking about. You know, I didn't think anything about it. So we went through Sunday, and then went through Monday, and then Tuesday. So I'm going to get tested. So I got up Tuesday morning and went to my personal doctor, and then she tested me, but then she sent me to get a test at another place. And it was actually 3 days later that I was actually in quarantine when I finally got the results of my test. Because when I went to take the test, on the way back home, I started getting weak. And when I got back home, man, I was so out of it, I didn't even know how to undo a seatbelt. You know.
You were early on.
Yeah, it was in March. It was in March. It was the last of March, and they knew nothing about it then, you know, except that it would, you know. Yeah. And so I was sitting there, I was trying to undo the seatbelt, and my son was looking at me like, man, something wrong with Dad. And so then he said, I get it. So he got it. So I got out of the car, but I had to have some help to stand. So I went in the house, and I was just weak as water. I felt no pain, none whatsoever. The only thing that happened was the dry cough and the weakness. Mm-hmm. And once I got into bed, man, that was it. I can't really remember a whole lot of stuff after that.
So what I'm gathering is that there's a lot of different symptoms here in you, Kenneth, and in you, and a lot of normal people just don't know what to think, Doc.
Right.
I mean,
yeah.
So now you got a dry cough, you got weakness. He didn't mention his hallucinations of things that was in the room and wasn't in the room.
Right. Matter of fact, that I saw nothing that was actually in the room. Mm-hmm. Everything I saw was somewhere else, was something else. Mm-hmm. You know, like I was there, and in my mind, I'm sitting I'm around a giant coffee pot. You know, I don't remember the bed I was laying in. I don't remember the walls. I don't remember nothing. The only thing my wife just telling me, said, well, you kept praying all the time. But I don't remember that. I don't remember any of that.
Can you expound on that, Doc?
Hey, COVID, we are learning more about COVID. We do know that COVID attacks many organs. So we know there's effects the heart, the brain, the lungs. Predominantly, we think of coronavirus as a lung problem, but we're learning about the impact on the brain, learning about the impact on the heart. And so, you know, it is a tough virus. And again, what makes it tough is that the symptoms can vary. So when we're standing, you know, as gatekeepers of healthcare, and we're saying, well, you're not coughing and you don't have a fever, you don't have coronavirus. Well, that's not true. You know, you can just have weakness as the only symptom. Headache that's different from your usual headaches is the only symptom. Some people have just a little sinus drainage, and then there are many people who have nothing at all and are able to transmit coronavirus, and that's one of the mysteries of coronavirus that we're probably going to solve late. Is because, you know, how do you encourage someone who feels fine to change their behaviors? So we know, and that number of asymptomatic coronavirus is a significant number. And that's probably what drives a lot of the infections that's going from, somewhere in the community to households and then through families. So we have coronavirus can give you everything from heart stopping breathing, to absolutely nothing at all. And all of those people have the potential to transmit coronavirus, which is why, getting back to some of the advice to people is that who could have coronavirus? You could have coronavirus, looking fine, feeling fine. And so changing our behaviors to consider that, so that we can cut the spread down, so that we can get to that point where we can see the benefits of the vaccines. We can kind of relieve some of the strain of healthcare. But again, it goes back to, it can be everything all at once at 100 out of 100 intensity, or it can be nothing at all.
Okay.
Can I ask this?
Sure.
Now, the two things that actually happened to me that I do remember, I lost my taste and my smell.
Yeah.
Those two things left me. I mean,
Yeah.
almost immediately.
Yeah. So those symptoms are, if you lose your taste and smell, you might not even need a coronavirus swab. You got coronavirus. Is those, as we look at, we have ways of saying, of figuring out when things are more likely and when things are less likely. And we use words like specificity, and sensitivity. But that loss of taste and smell, I mean, I don't care how many negative coronavirus tests that you take, you suddenly lose, taste and smell during coronavirus epidemic. You got coronavirus, and you need to act as such. I found that for some people, it's present at the beginning. That's their signal. For other people, it didn't come till later on in the back end. And what adds to it, last week we had a question about when will it come back?
Right.
So we don't even know that yet. We don't even know that exactly when it comes back. For the most people, it comes back in the general recovery period. But there are some people that it's still altered. And it's, I've had people who lost their taste and smell. It is probably one of the more uncomfortable things that, uncomfortable sensations that people can have that, I hope to never experience it, but it's pretty uncomfortable and scary. You don't think of it as painful and agonizing and things like that until, you taste something and it tastes like nothing.
Yeah. Well, Dr. Raper, mine came on the back end about 4 days later, but it started out as a peculiar metallic taste in my mouth. It's like I can taste like, back in the day when you just stick your tongue on a battery, and you get that metallic.
We're not that old, so okay.
Anyway, a little 9-volt battery, you just, is it dead? Or do you, but that little metallic taste, and then all of a sudden, I couldn't smell anything because my wife makes coffee every morning, and I can smell it when she's brewing it in the kitchen in there, and I couldn't smell it. But then the other thing that came through that was peculiar was everything was salty. We like to eat greens, and so and I usually cook them because I can cook greens. Mm-hmm. Anyway, they were so salty, and Cheryl, my wife, was saying, "No, they're okay, perfect." Well, when she left the room, I took them greens and rinsed them out in the sink to get some of what I thought was salt all in it. But that was the other thing. But I hadn't heard anybody say anything about the yesterday, as a lady that works with me, Miss Rogers, Betty Rogers, we were walking out together, and she said, "Ken, I had this metal taste in my mouth."
You knew exactly what she was talking about.
I knew exactly what she was talking about. I said, "Well, Betty, mine also went into this salty thing. Everything I ate was just, even a soda was real salty taste. I could taste the salt in it for some reason."
Let me ask this. Now, both of you guys had physicians at the time. It wasn't Dr. Raper.
Correct.
Right.
But one of the questions is that what were the alternatives that they gave you guys? I want to see, can we compare is what this doctor would say. So we're not going to call any names, but
sure.
What did they tell you to do when you went home?
Well, before I left the office, my healthcare provider said, "Ken, I want you to get some zinc, Q-certain vitamins, vitamin D. If you got some B12, get B12. Something else. Q-Certain, which I went to this health food store and there was really a short supply on that. But basically, Robert, it was and I was surprised that they want to attack this thing with extra doses of vitamins. And for African Americans, according to my healthcare provider, we really need to take vitamin D. And so I thought that was kind of unusual. But I got vitamin D, I got the Q-Certain, zinc, and B12. It seemed like I'm taking something else every morning.
So is that the same with you also, Bishop? Is that the same?
Well, actually, Robert, when I came down with it, they prescribed nothing.
It was early.
The only thing that the doctor told me was isolate. And of course, I was already in isolation at that time. And matter of fact, I was about dead, I thought, because I was weak and I couldn't taste, I couldn't smell, and I couldn't even hardly get up to go to the bathroom on my own, But because I wouldn't answer my phone, that's what it was. The doctor was calling me, but I wouldn't answer my phone because I didn't feel like talking to nobody. And when I finally did get it, she said, "Well, you tested positive and you need to isolate yourself." But I guess it was so early at that particular time that they didn't know what to do about it,
So we've gone from doing nothing to a little something.
Right.
Doc, is that?
So it's a perfect illustration of what happens when you're learning in real time. So, if you'd asked me a month ago, what did I recommend? And so as my routine practice is I don't routinely recommend vitamins and supplements other than vitamin D because I recommend the alternative, eat a healthy diet. So get the vitamins through the healthy foods. Now, because the hospitals are full, because the resources are strained, I'm looking at what others have done in different places. So vitamin C, vitamin D, the quercetin that Mr. Wheeler mentioned, and zinc, we're not entirely sure how they work. We know they don't attack coronavirus themselves. We're using kind of small studies that aren't as, when we're talking about the research that we use to decide what we do or don't do, the science that got us the vaccines, we consider that the gold standard. We're talking about smaller studies, not necessarily in lots of groups, not necessarily kind of really proving a point that it works or don't work. But I'm recommending the vitamins on the offhand that I don't think they're going to hurt anybody, if they're taking them in just the recommended doses. And on the offhand that it does help with coronavirus, I'm all for it because I know the strain that what I'm under. So now I'm thinking 4 or 5 steps ahead because I know that this week compared to a few weeks ago is not the same. Previously, if I had a person that I knew absolutely needed a hospital bed, even when the hospital was at previous levels of fullness, I was sure that patient could get a bed. I don't have that surety now, and I think that's hospitals across the state, across the country. There's not that surety. There's a lot of people who need hospital level care who aren't able to get the hospital level care, and it's more than space. It's a staff type thing. And so what I'm doing when I'm thinking about treatments, yes, I'm recommending the vitamins and supplements where I probably wouldn't have done it. But there are also some things that we're able to do now. And again, we're learning in real time. So if I had a patient who's diagnosed with coronavirus and they're in a high risk group, so that's older than 65, heart disease, diabetes, high blood pressure, kidney disease, on medicines that suppress the immune system, and they're not severe, so they have a mild case right now, there's an option that is available. They're called monoclonal antibodies. And so the antibodies are the little things dissolved in the blood that can attack bad things, viruses and bacteria. So these monoclonal antibodies have been all shown that they can neutralize coronavirus. And so they concentrate it and put it in an infusion. Now, for people who are in the high-risk group, so over 65 plus those risk factors, obesity is another risk factor, or if you're 55, have heart disease, high blood pressure, or on immunosuppressants, you're also eligible too. So this antibody infusion is about an hour-long infusion. Is done at an infusion center, and in some studies, and again, we're studying it as we go along, so we're going to learn more about it as time goes, but there's some evidence that it decreases a person's chances of having severe coronavirus.
Is that covered by insurance?
You know, I don't.
That was my question.
Yeah.
Oh, I'm sorry, Ron.
I haven't had any, you know, it hasn't come up, and to be honest, I actually haven't. The patient I offered it to didn't want it, and so I hadn't been able to be early enough, or my patients don't have mild coronavirus. And so with coronavirus, you know, the simple kind of cutting point between mild, severe, in the middle is moderate, is oxygen level. And so what would be a normal oxygen level that I wouldn't even think anything of? So your oxygen should be 90 and above. With coronavirus, if your oxygen level is less than 95, so if you're 94, a year ago, I would just say, hey, go home, rest, you're good. But if your oxygen is less than 95, then you actually have moderate coronavirus.
Wow. So
Robert, you can buy these devices.
that's what I was going.
Yeah.
I've done it again. Yeah, I'm sorry.
Yeah.
Hey, no, Ken, you're on it, son. You're on. I will say this just for our Facebook. Would y'all just share this because this is dynamic information that's coming from Dr. Rayford, and sticking a pin in that, Ken, if I was going to ask, everywhere we go, they check the fever
Right.
as coming in, but now I hear you guys talking about maybe checking the oxygen level, and then is that pretty expensive or is that easy to do?
You can buy one of those little things that slips on your hand, I guess a finger or something like that. It'll tell you.
Oximeter.
Yeah. And I'm talking about, my daughter bought mine, and I want to say it's less than $15 because she's cheap like a daddy. But anyway,
She's not that cheap.
yeah, okay. when I'm paying for it,
Okay.
yeah, she better be. But you can check your own oxygen, get you a thermometer, and then also I failed to mention I bought one of those nebulizers. This is a breathing treatment. It's about $20 at your local stores, but you have to get a prescription from your healthcare provider. You can just tell them, hey, I want to do some breathing treatments, and I'm pretty sure they'll write you a script for it. Send it over to whatever your pharmacy is, and you sit there, and that really helped me a lot too. But those breathing treatments, old-fashioned breathing treatment.
Yeah.
So one thing I wanted to ask there, especially with our houses of worship and then the meetings that people are still having, you're saying that that's something that could possibly be added to the security part of going in on a safety check, or is it something you would do at the house?
No, I would say, honestly, I worry that we've over-relied on fevers, and I have just gotten comfortable checking people's fever and feeling comfortable that people without fever don't have coronavirus, and that is wrong. So when we first were getting descriptions of coronavirus early on, almost a year ago, where they were looking at fever, the fever occurred during the course of coronavirus, not at the beginning. And so when they looked at people who were hospitalized for coronavirus, 80-90% developed the fever during the hospitalization. 35, 40, and I'm blanking on the number, had fever on presentation. These were people sick enough to be in the hospital. So they were sick enough to be in the hospital with coronavirus and didn't have a fever. So I do think that fever checks are part of what we do, but we have to consider that person who looks fine, you need to consider that Dr. Rayford got coronavirus. I'm looking fine, I'm feeling good. You need to consider that I have it. You need to consider that your family member, the one that you love a lot, has coronavirus and can spread it to you. So older adults who've withdrawn from other things, who don't go out, but their kids are allowed in the house, but not masked and things like that, Right now, I believe the most coronavirus transmissions are happening in people's houses.
Wow.
It's happening at the dinner table. It's when the masks go off. Coronavirus is a virus that will spread if you give it an opportunity. And the opportunity is when people let their guards down. We worry about Thanksgiving, and we've actually seen the consequences of the Thanksgiving surge. You know, we've seen hospital beds fill up. We've seen funeral homes fill up. The Thanksgiving surge. We're still getting a good sense of the Christmas surge and the New Year's surge. So in terms of the screening part, yes, screen for fever, screen for symptoms, but you also have to consider that that person who's feeling completely fine may either have coronavirus and not develop any symptom, develop symptoms 3 days from now, but they're infectious. We know that with coronavirus, people can be infectious a couple of days before they feel symptoms. So just because someone's fine today doesn't mean that you're off the hook. You're out the window. So, I probably underemphasize temperature checks if it encourages people to not let their guards down, to not let the guard down, the distance, doing things outside is better than inside, keeping crowds small, limited mingling between folks outside the nuclear family, within reason. Not telling people what they can and can't do, but those are the things that can help decrease the spread. Wearing the mask, congregant eating is probably not a great idea because, again, coronavirus there's some interesting stories out of Korea where they've traced and found that someone in a restaurant was able to spread coronavirus by more than 6 feet, that person was 12 or more feet away from the other person. So 6 feet is not a hard and fast rule. We're using it. It's better than, better than nothing. But again, it just goes back to don't let your guard down. Now, to get back to the oxygen monitor, I only recommend that for people who have been diagnosed with coronavirus.
Okay.
Because that can tell us what we're dealing with, whether we're dealing with mild coronavirus. People will feel bad. Some people will feel like they're going to die, but only have mild coronavirus. So that's more of a designation for us in healthcare to say, this is the person that's at risk of dying. This is the person that may feel bad and feel like they're dying, but they're not at the highest risk. But that oxygen probe can be that signal that, things are going. When you're down less than 90, I don't care how full the ERs are, you got to go. You got to go. There's just that's one of those, you can't wait, like, things like if you're having a stroke and heart attack, you got to go.
That brings up a question. I'll dig it just a little bit. I got one for you later, Bishop Wilson, but hearing the news and Ken talking to you, kind of basic conversation, is what's scary right now to me. Some people that are getting sick and they end up going to the ER or whatever, there's no room.
Mm-hmm.
And in other cities, I understand that if it's gotten to a certain level, they're just leaving them at home. Mm-hmm. So this tells me that the people that's feeling well got to make some serious adjustments. Am I in the ballpark of this?
Yeah, I think I couldn't shout it even louder.
Yeah.
We have to do better. We have to get the coronavirus spread down, that our resources are already strained, and we can't get out of this if the people who are feeling well and potentially spreading it, if those people are continuing to spread it. It's not enough to sequester the most vulnerable people. We tried to do that. We've shut down nursing homes, but unfortunately, staff still have to come to work, and they're engaging and outside in the environment, and so coronavirus comes to the nursing home through staff. And so we know that coronavirus, when given an opportunity, will spread. We know that a lot of spread is people who aren't sick. We know that the resources are already strained. Unfortunately, we also know that after the cases spike, unfortunately, the deaths and hospitalization rates spike a couple of weeks later. We've broken so many records that it's not even newsworthy. You know, we've lost more people in the day than we've done historically. You know, the deadliest single day in the United States kind of, you know, for one event, you know, yesterday was the highest. You know, it's about 1,000 more people died, were reported dead yesterday than the 9/11 attacks. And so really thinking about that impact of coronavirus, it's really important. Again, you can feel completely fine and have coronavirus. So, you know, what do? You do your very best to keep from catching it. If you got it, you do your very best to keep from spreading it. Keep from catching it and keep from spreading it.
So, which brings up the vaccines, Pfizer, Moderna.
Yeah.
These gentlemen
Yeah.
that have been diagnosed, tested positive, recuperated, are they in line now to take the shots right after they have been cleared of corona?
Now, my diagnosis started December 7th.
Yeah.
Okay.
And so now it is a month later.
Yeah.
And so, you know, they, according to the reports, you're supposed to wait 90 days. Well, somebody told me just this morning that there was a physician saying that it's okay to go ahead and take it. So I'm anxiously waiting on
The answer,
Dr. Rayford's answer there. So.
Yeah, so we're learning in real time. So today there was actually a report about that 90-day. We've kind of taken that 90-day as an article of faith, and you have to be careful with coronavirus, because what I'm saying today, a month from now, may not be the case. And that's, we've learning in real time.
That's
And
why
so
these conversations are
learning in
important.
real time, that's why these conversations are really important. Humility is important. What I'm saying today could very well not be the case a month from now. That's humility, you know, and it's just, that's what happened when you learn better. I think the mark of adult critical thinking is to continue to question and learn, but also employ what you learn to make the changes. So the 90-day, it's been more of a rule of thumb that we thought that the risk of reinfection with coronavirus was low in that 90-day. There's actually a report out where they looked at people's antibody levels. It was a small group of healthcare workers who had coronavirus. They found that maybe up to a third had a significant decrease in the amount of protective antibody within that 90-day period. So they may not have been as protected in that 90-day period. So you still need to wear a mask. You still need to isolate if you've been exposed. So that 90-day may not be as protective as we thought for everybody. We know that when we let natural infection lead to immunity, that immunity is variable. So, you know, Bishop Wilson may have a different immunity than Mr. Wheeler. I might have a different immunity, and this is just if we get infected with coronavirus and just depend on immunity. Both vaccines were actually studied in some people who had already had coronavirus infections. It was shown to be safe in those people, so there's no downside to people who've had coronavirus to get that vaccine. And those groups were included, you know, in terms of the analyses to show that both vaccines reduce symptomatic coronavirus and, more importantly, reduce severe coronavirus. So what I'll tell you is, as long as you're, and the state health officer for Mississippi is clear, if you have had acute coronavirus, wait until you're asymptomatic and you're out of your quarantine period.
Okay.
And if your time is up for the vaccine, so if you're 75, you know, kind of in the general community, if you're 75, you know, starting next week, probably is going to be next week. The state health department announced today that they're going to start accelerating who they're going to provide the vaccines to beyond healthcare workers. For general patients, 75 and older, they're in the first group. Probably within the next week is going to be 65 and older, plus those with the comorbidities. But it looks like, as far as announced in this area, only the state health department has announced kind of how they're going to do it. Our health system hasn't announced how we're going to deliver the vaccine to the general public yet. That announcement could be coming soon. I don't know about that. I'm not privy to that kind of those determinations. But if you're asymptomatic and you're out of your quarantine window, get your vaccine. Because now compared to immunity through infection, the immunity through the vaccine has been more predictable. And that's because we're studying those groups. That's because we're still watching those groups. That immunity through the vaccine is more predictable than the immunity through the infection. And that's why, I tell people that when your number comes up or when your group comes up, as long as you're not currently symptomatic and in your quarantine window, go get it.
Well, which brings me to a question, and I'm going to put you on the spot. I know that you're just a little bit older than the rest of us on the stage, and you have, you fought this coronavirus and was victorious. And we're not here to say, to tell anybody you gotta take the vaccine. But I want to ask you, Bishop, just especially for the African American community out there, what you went through, do you plan on taking the vaccine when the time comes?
When the time comes, yes, I do. Robert, I was thinking like this. There's nothing that I could think of, and I'm sure that it is, but there's nothing that I can think of would be worse than what I went through. So, yes, I'll take the vaccine, gladly. If I had one tonight, I'd take it. Seriously,
Doctor had one in Jackie Potter.
Because I am, I'm 69, so it's not that I don't have anything to lose. I do have a lot to lose, but I'm just like, I want people to understand that I don't believe that this vaccine is designed to kill or to destroy or to lead us into a place that we don't need to go. I believe that it's designed to heal, and so I'm willing. Yeah.
I pose that same question to you, Mr. Whitley.
Well, again, you have to think back, and I'm 61, okay? And so I do remember people talking about the polio, the disease or whatever you want to call it, going around and concerns for that. And people, Dr. Jonas Salk, I guess, came up with the vaccination for that, and there were people that were concerned about that, but then they started seeing more and more people die or come up with these terrible outcomes from polio. And so why not take it? I mean, as Bishop just said, whatever that vaccination may do to you, it couldn't be any worse than what you may experience. And as Dr. Rayford, I was glad to hear him say that, maybe, because I'm thinking that I'm not bad off as some people are saying. So I have different levels of immunology or whatever you want to call it. It could be different. So yes, I would take the I would take the vaccination simply because I don't want to pass it on to anybody else.
Right.
We postponed my daughter's wedding because of this. I felt well enough to go on, but no, this is, we had a limited number of people there, but I still don't want to be the source. And then, and so then the other question about that, Robert, and you, your prior experience with law, people were saying, well, how can you make people take the thing? The government can't make you do anything. Well, okay, my wife is the director of the hospital's child care center. Well, and anybody out there in our listening audience, if you want to take your child to a daycare somewhere, you got to show proof of I can't think of the name of the shots you had to take, but they had to show proof of having had their vaccinations. And it may turn out to be that's the way this is. In order to do certain things, you got to prove. Now, Bishop Wilson and I probably could roll up our left arm and you'll see a little, we got a tattoo, a permanent tattoo. Now, I don't know if it'll turn into that, but I know he's had his rubella, measles, and mumps shots and all that kind of thing from back in the day. Also, I got another one from when I was in the military. They just line you up and just, that's no question, they just shoot you. Yeah. It's your first shot, wait on that second one. And you hope you will survive that second one. But yeah, I mean, take the shot. I mean, it will be better off for you and your family and the people that you love.
Yeah, one thing in our last session, we had Dr. Eric Lewis, who was traveling tonight. He couldn't be with us, but he made a statement that stuck with me, Doc. He said that if we don't get serious and start doing what we need to do in the preventive phases, then other people will be making decisions for us and our families. And
Mhm.
that's a scary thought to me.
Yeah, and that's exactly what we're really close to, is that, you know, the decisions of, you know, utilizing kind of, you know, our medical expertise and our resources. Those decisions may not be, you know, made by the families if we're continuing to strain those resources. When we're in, you know, if we're in, you know, and there are specialties that train for these mass casualty type things. People with military experience, emergency medicine, in training for mass casualty type, you know, events. And, you know, we should really consider coronavirus as a mass casualty type event. That decisions have to be made based on how you're going to deploy precious resources. And those decisions, unfortunately, you know, are made based on, I mean, they're real calculated. And so it's not about personality and things like that. And so if we can't turn this around, you know, we're going to feel that. And that's, you know, that I don't anticipate that, you know, that's a feeling that Americans will forget. You know, looking at the experiences in Italy, you know, it's a very traumatic experience for both the people who are on both sides of that challenge. You know, that's an experience that you don't forget. So you're right. I totally echo Dr. Lewis when he's saying that if we can't do it, our say in kind of what we get or how we, you know, request care is going to be significantly, you know, limited.
We're rolling around, and I'm going to get to you to coming up on our 45 minutes we've been talking. And so I'm going to ask for closing arguments, if you don't mind holding that to the closing arguments. But I did want to reiterate again that this is Project-elect, enthusiastic leaders engaging in changing times. And we have Dr. Rayford here, who is a Project-elect member. And we want to have these ongoing conversations. And I think probably we're going to roll on again, because one of the things you said is that you guys are learning every day. And so we're getting ready to get out of here, and I have a question that we'll add in your closing thoughts there. But we're going to get ready to go, but we'll start with you, Bishop, on whatever your closing thoughts will, and enter your point at that time. We'll roll back around, and we'll close her out.
Okay, well, what I wanted to say to the listening audience is this, that, you know, there are a lot of people who had the coronavirus, but they didn't feel as bad as I felt. You know, some was asymptomatic, and you know, they may have lose their taste or they smell for a brief moment, but then, like you said, they still can spread it. But I want to say this, with the way that I felt, I mean, I don't know how I feel to be dying, but that's how I felt. And then there are people who are dying, people who are suffering in hospital beds with oxygen ventilators on. You know, I want to encourage those of you who are listening, don't be a part of that problem. Do what you know you need to do so that you don't get to that place. You know, get tested, and if you test positive, then do whatever you need to do. But please don't wait. I watched a commercial, and I'm done, this evening, where there wasn't commercials on news, where a guy was saying that he just wanted to go spend a little time with his family, him and his wife and kids, with his mom and dad, and got there, all of them caught the virus, and his mom and dad both died.
Oh.
So you don't want to be guilty of that, you know. So do what you need to do so that this thing don't happen. Because a person that's my age, with underlying conditions, somebody come and spread it to me, I may not make it, 3 days. I don't know. But let me say this, Doc. I caught the virus in March of last year. I had just gotten out of open heart surgery in August of the year before. And I was just wondering, man, now it didn't affect me as bad as it did some people, but that was a possibility that it could have gotten me.
Yeah.
Yeah, that was short, quick one.
Yeah.
That was a short answer. Okay.
I don't mind sharing this with our Facebook audience, that when I was in that clinic and my physician tells me you got COVID, I'm thinking, where in the world did I get this from? I'm trying to be safe. I'm thinking about, oh man, we got this wedding coming up. We got to postpone this thing. I was hurting to the core, and I don't mind sharing that. But also, things can be put off. My daughter put off the wedding a week later. Things would work out fine. I talked to a friend. Man, Mardi Gras is going on, coming up, whatever. Man, Mardi Gras been going on since 1860, whatever. Okay, maybe 1777. I don't know. But New Orleans been flooded 100,000 times. And let's don't get so bent out of shape that we got to do Christmas. We got to do things. I got to do New Year. It is not that important when you watch your loved ones pass away. Right. And when you come to the medical center and under state guidelines, visitation is not going to happen. And you're going to get upset about that. And I don't want to see people get upset about that.
And you are the security director, so you know this firsthand.
Well, we always try to treat people as though they are our customers and that there's another hospital across the street. We try to treat people with respect and dignity. And so, but also with security, you treat people with respect and dignity until they give you opportunity not to. And then you offer options, and one of them is that you can always leave and that kind of thing. So we don't want it to get to that point. But it's that serious. Mm-hmm. Dr. Rayford you mentioned about the ER, CEO Shane Speeds and the Chief Medical Officer Jeremy Blanchard mentioned on the television program the other night, the news, that yes, if you come to that ER, you're going to have to wait a while. And a while may be anywhere from 8 to 10 hours before you can actually, if you need to become an inpatient. And so there are people working, I can guarantee you right now, trying to figure out a strategy to get Dr. Rayford's and others patients in if they're sick. But do those common things. Don't gather, folks. These things can wait. Right. These things can wait, and it'll be here next year. Right. The good Lord, and I'm going to speak like a preacher, not taking his job, but I do know what I believe in, and I know the good Lord will keep providing as we always been happening. But we can do something. He gives us sense.
Right.
Yeah. One quick question that was asked last week was,
flu shot?
Do I take the flu shot? And did he answer that? I missed it.
No. Matter of fact,
well, my time is up.
Yeah.
Thank you.
Yeah.
I want to throw that in there.
Yeah, so I'll actually answer that question. It wasn't studied getting the flu shot and the coronavirus shot at the same time, so it's not recommended. So it's not recommended to get the flu shot and the coronavirus shot at the same time. I encourage you to get the flu shot when you can. And so there's no line for the flu shot. You find Walgreens, CVS, come to different clinics, get that flu shot. We've been blessed to not have a significant flu season, but we don't know if that means flu season is just going to be mild, or we don't know if flu season is just going to be delayed. One thing I do know is we don't have the capacity to deal with any degree of flu now, along with coronavirus. And so in closing, I would probably end with some optimism that no matter how bad it looks and things are bad, we still can do it. And in fact, that's the only way that we're going to get out of it, is if we do it. If you look in the mirror, you can have coronavirus, which means you can spread coronavirus. So you need to personally do those things to keep those most vulnerable people in your lives safe, which means foregoing some things. Delay, don't deny. Delay those things. There's nothing that's more important than protecting your loved one. That birthday, that graduation, that sporting event, that basketball game, there's just so much that, and what I'm not asking you to do is to kind of completely shut down. What I'm asking you to do is to look in the mirror and to consider that you do have coronavirus. And what does that mean? Do what you can to cut down your risk of spreading that coronavirus to someone who doesn't know that you have it. Protect others and protect yourselves. We know what to do. We have to do it. And the vaccine is going to be a part of the solution, but don't be mistaken that the vaccine is the answer to the predicament we're in right now. The vaccine is going to work in its own time. It's not soon enough for the vaccines that were given out 3 weeks ago to have the impact on coronavirus cases. What we do know makes an impact. So social distancing, doing things outside, wearing a mask, not letting your guard down, washing your hands, keeping the group small, and just really being vigilant. And I think, we have a really significant adversary in coronavirus. Coronavirus doesn't care your profession, doesn't care what's in your bank account. It doesn't care how good you are. It doesn't care your educational level. Coronavirus will spread if you give it a chance. And we can do our part to decrease that spread till we get to that point that the millions of doses of vaccines that's been given out in the United States are having an impact. We can get to that point, but we have to get to that point with a healthcare system. I'm a young physician. So, there's the wearing down of resources, just work, but then there's the psychological impact of going in and day out, seeing numbers you've never seen before, being asked to be Superman every day, but knowing that you're not Superman, being asked to be Superman every day, being told that you're a hero, but not enough of a hero to listen to what we advise. That's a psychological impact. Many of us in healthcare aren't going to stay in healthcare. That's a resource that we're at the brink of losing. There are people who are tirelessly been at the bedside since March. They're tired. And so we really need to do what we can to kind of protect that special resource. We thought the ventilators in March was going to be what was going to be our challenge, but no, it's the people that work those ventilators. It's the nurses at the bedside, the respiratory therapists, the physicians, everybody, the people who clean the hospital rooms.
Right.
All of those people, have been working tirelessly. And we've gotten good food, good dinners, we've gotten prayers, but what we hadn't gotten is we hadn't gotten people to get the message.
That was well said. I will have to say that I am really thankful to be part of this conversation. Bishop Wilson, thank you for just being personal and sharing it with us. Kenneth, you went to some areas that I thought that need to be said, but I mean, you said them, and because you work at the medical center, you guys see this every day. And Dr. Rayford, man, I tell you, what you've said here tonight is, money cannot pay for it, and that tells me one thing about the people on the stage is that you care. And we want to say, Project Elect, we have thank you for all the co-workers here at the hospital, the medical staff, the floor sweepers. We appreciate you guys. We also thank Maurice Schompert, who's behind the camera tonight. We appreciate the hard work that he's putting in his community and what he's doing for us. I'm sure we will be back. There's a lot more to be said. This is an ongoing conversation. Again, Project Elect, appreciate you guys. 6 o'clock came quick. But we're going to continue to ask for your prayers for our community, our city, our state, our nation. We know what's going on, and it's just going to take all of us pulling together if we're going to get over this. And I know, and I don't mind saying it, we are all believers, and we know what the solution is. We're going to have to pull together and be that one body in Christ. I believe that's what he wants. So thank you again, Robert Hall, co-chair of Project Elect, and good night.